In this lecture, I'm going to talk about secondary data analysis and also big data sources. I'm going to start by defining what primary and secondary data sources are. Primary data sources refer to data that's collected by you, the researcher, for your specific research project. So you define a research question, you go out and collect data. That's primary data. Secondary data refers to data that's collected by other researchers. So other researchers might conduct surveys and surveillance of a particular population, and they might make that data available to other researchers to use for their own studies. And so anytime you obtain data that was collected for another study, or perhaps for a completely different purpose, that's referred to as secondary data. There are many different types of secondary data sources. Secondary data sources can include data that's collected by other researchers. There's secondary research data sources, and these might be things like survey questionnaires that were administered by other researchers to answer their questions. But sometimes, those data can also be used to answer other questions that weren't directly analyzed by the researchers who collected the data. So you might be able to obtain access to that data to analyze and answer your own research questions. Sometimes archival data and record systems can also be used as good secondary data sources for research. So these are things like birth records, death records, also medical records. More and more researchers have linked death records to survey records based on individual identifying information. People are using as healthcare organizations move from paper to electronic systems, the data that's collected by medical providers as they enter information about patients into those systems can be extracted and analyzed and used for research purposes. There are ongoing monitoring systems and surveys. So a lot of states, even the federal government and different cities, conduct routine public health surveys to gather information about risk factors, to monitor and conduct surveillance on things like smoking, exercise, healthy eating. I'll talk about a few examples of these. Lastly, billing and transaction records can also be a source of secondary data. One of the common sources of billing and transaction records that I'm familiar with are healthcare claims or medical service claims. So when a patient receives services from a healthcare provider, usually such as a doctor or a hospital, the doctor or hospital might submit a claim to a health insurance company to receive reimbursement for the services they provided to the patient. And so those claims, those medical claims that indicate what type of service the patient received, when they received it, how much of it they received, can be used for research to answer some really interesting questions about the quality of care and the types of care that different people receive and what types of patient populations are at greater risk for poor healthcare outcomes. So you can do some really, even though those billing records were not necessarily collected for research purposes, they can still be used for research because it's a very sort of detailed set of information. There are a few advantages of secondary data sources in comparison to primary data. The first is cost. So primary data, because you're collecting it yourself, usually you have to assemble a team of people to help you gather that data, and it can be very resource intensive and costly. So secondary data sources are much lower cost because usually they're easily available and anybody can just download and analyze them without having to go out and collect the data yourself. They're usually pretty high quality. There's usually a lot of resources that go into collecting those data. Organizations might administer surveys that can be downloaded, and there's usually a lot of effort and resources that go into collecting that data. Large teams of people, very smart people sort of designing really well put together and validated surveys, and so you have sort of access to you can have access to some pretty high quality secondary data sources. A lot of times also these are very large surveys, which is an advantage in terms of doing a statistical analysis because you're more likely to sort of have you're more likely to have confidence that your results are and your sample is representative if you're looking at a very large population or a group of people. Many secondary data sources are also easily available through the web, and you can go there and download them. So it's very easy to obtain secondary data. Many secondary data sources are longitudinal in the sense that they follow people over time at multiple points in time, and that's also an advantage from a statistical analysis perspective. You can use more sophisticated methods to look at trends and changes over time in people. As I mentioned, because of the high quality nature of the data, the measures are usually collected in a reliable way, and they're usually pretty valid, established survey measures or indicators. And a lot of times also, you don't necessarily have to use secondary data sources for your research project, but the secondary data might form a basis for your preliminary analysis. So sometimes you might just want to describe a population of people, and then maybe go out and collect more information yourself later, but sometimes you can use secondary data sources as a starting point for just maybe describing a population and the characteristics. So you're doing preliminary analysis with secondary data sources. While there are advantages of secondary data sources, there are also a few disadvantages. And these are also well documented. So many times, secondary data sources might not always be a perfect fit for your research needs. There might be missing key measures that you're interested in studying. So maybe you're interested in a particular variable, a set of variables, and they might have one variable but not another. And so without because it's not a perfect fit, it might be difficult to answer your research question. Another thing is, because these data sets are made available, a lot of times many of the variables are sort of pre-coded, and you don't necessarily have access to the raw data, which can be an issue because you don't know how somebody transformed particular variables, and sometimes if there's not very good documentation, you don't know exactly what those variables represent. And along the same lines, you might not have complete familiarity with the data collection process, how those data were obtained, how they sampled them. A lot of times there's pretty good documentation, but if there isn't, because it's a secondary data source, you might not have full information about the data collection process. Some secondary data sources can be pretty kind of complicated. There might be multiple files, and they might be in different data formats. So some secondary data sources, particularly like healthcare and medical claims, require some pretty advanced data analytic skills to format and analyze the data sources. Alex Smith put together a set of steps for conducting secondary data sources, and this was for healthcare research. But I think it applies to, I think it's a good framework for any type of secondary data analysis in the social sciences. So the first, anytime you're using, this is kind of a good framework for approaching a secondary data source. Like any research project, you want to start by sort of defining what your topic is and have a basic research question. You want to review existing literature to find out what other people have found and make sure that your question is a good one and that it hasn't been answered before and that it advances on prior research. And then once you have a really solid understanding of what your topic is, what your question is, you've reviewed the literature, then you can start looking at different secondary data sources, because there might be several. There might not just be one. There might be several secondary data sources, and you'll have to weigh the pros and cons of each data source and see which has the most set of detailed measures that might be appropriate for your project. And a lot of times you might consider linking multiple data sets together. That's another really cool thing about secondary data. Sometimes you can you don't have to use just one. You can link different secondary data sources together. Perhaps some of the national health surveys can be linked with records of births or deaths. And once you have your data sources, you really need to get to know them. Look at every variable, find out exactly what's measured, find out exactly who's in your data set, what types of people, the characteristics of those people. And then you want to really focus your analysis to analyze the data in a way that allows you to answer your research question, present findings in a meaningful way. This is just a kind of a general approach to using secondary data sources in a research project. These are a few places where you can find secondary data. Specifically in New York State and New York City, the state and the city have made available several data sets that they collect for public consumption. Anybody can go to Open New York and NYC Open Data to download some pretty interesting secondary data sources, including 311 calls and restaurant ratings, all different types of data that the city and the state collect. The Inter-University Consortium for Political and Social Research, ICPSR, is an organization at the University of Michigan that creates sort of a data bank or a data repository for data that was collected by other researchers. MEPS is a health services data set. ResDAC is also an organization at the University of Minnesota that makes available healthcare claims data from Medicare and Medicaid. Open Baltimore is similar to NYC Open Data. It's a city website that makes available data that Baltimore collected. Centers for Disease Control and Prevention is a really amazing source of secondary data. They conduct a lot of surveys, the NHANES, the NHIS. I'll talk a little bit more about those surveys. They make them available. You can download them. Increasingly, also in recent years, the Medicare website has also made available data on healthcare quality, specifically differences in healthcare quality across providers that serve Medicare, Medicaid patients. And finally, the federal government has also recently gotten on board. You can go to data.gov and obtain data that's collected by the federal government. One of the most popular sources of secondary data is the United States Census. It has a lot of population figures on sex, age, race, ethnicity, and language, and nativity status. It's oftentimes one of those data sets that gets linked to another data source for your research. The behavioral risk factors surveillance system. So I'm going to give you just a few examples of different secondary data sources. This is one of those risk factor surveillance systems that monitors. It's conducted by I think about 15 different states administer this defined survey that collects information about different health and behavioral risk factors. So on this slide, I'm showing the consumption of fruits and vegetables, which is one of those indicators of having a healthy diet. And this survey allows people to, or allows researchers to look at the prevalence of different health risk factors. The National Health Interview Survey is conducted by the National Center for Health Statistics, and it's a very sort of general health survey, very broad. It's a large survey that's conducted every year, and they administer a survey to people in households across the United States. And it's a great source of information for defining the health characteristics of the U.S. population. Adolescent Health Survey. The Adolescent Health Study is also this really great longitudinal study that was conducted at different sites and schools in the United States to follow a group of students from the time they were in middle school all the way until the time they were young adults. So there's several waves of data. It's one of those longitudinal studies. And there's a public use data file that the researchers that conducted the study made available for other researchers to download and try to answer their own research questions. So I'm going to now sort of turn a little bit to a more recent topic, which is big data. Big data refers to massive data sets. We're talking millions, billions of records that are produced by people through their interactions with some of the newer technologies, particularly certain popular websites and mobile applications. And you've probably used all three of these mobile applications. So the ones that that are sort of at the forefront of big data are websites like Google and YouTube. So YouTube collects every time somebody views a particular video on YouTube, anytime somebody clicks the like button, gives it a thumbs up or a thumbs down rating, that's data that's stored electronically in a system, and somebody can analyze it to look at what some of the more viral topics are and videos that are being watched. And Google, you can use search terms to sort of identify topics that are being that are trending around the world. And Facebook also is a huge is the world's largest online social networking system. More than a billion users. Every time somebody hits likes or posts a status update, all of that information gets stored and can be used for analysis. A lot of times, these companies are using it for marketing purposes, but there have been research studies that have used big data. So, big data requires pretty sophisticated analytic skills, usually special computer systems for distributing statistical analysis across files, because it's difficult to sort of just download a big data source because there are millions or billions of records. So you have to use special software and systems to analyze the data. So I want to give you a quick example of a big data analysis. Google Flu Trends. Google works on something called Google Flu Trends, and they use search terms that people enter into the Google search engine to identify the prevalence of the flu. So they can actually estimate the prevalence of flu across months during a flu season, using the search terms that people enter into Google that are indicators of flu activity. So people might enter information about their symptoms or how they're feeling, and Google can actually, with some level of reliability, identify people who have the flu, and they can use that data to estimate the prevalence of the flu in different places, particularly in the United States.